All right, I'm Allison. I'm one of our orthopedic physician assistants here at Victory in Motion, home of knee repair, not knee replacement. And today I have with me Carla. Carla is just over a year out from our knee repair, not knee replacement program. As you can see here, we were reviewing her X-rays from today. Before I get into the X-rays though, Carla, can you tell us, since undergoing the knee repair, not knee replacement program, overall, how much better are you? What percent better could you say?
I am well 90 to 100% better.
Awesome.
Very pleased.
Great, so you're happy you went through with it?
Oh yes, it was way better.
Awesome. Now getting to her X-rays, there is one big point that I wanted to show here. So you can see these are Carla's X-rays. These are from today. This is dating back about a year or so ago. This is May of last year, and then January of 2023. These are like she's standing up looking at us. But one of the big take homes here is you can see back in January of 2023, again, we are looking at Carla's left knee specifically today. The medial joint space narrowing here, if you look, and then you compare it to today's, you can see, I mean, visually that it does look like there's more space between the femur, the thigh bone, and the tibia, the shin bone today than there was back in January of 2023. Now that is very well possible that she could have regrown some of the cartilage back by doing, again, our knee repair, not knee replacement program that incorporates some regenerative therapies. So again, that was one big take home for her today, of course, in addition to how great she's doing. Carla, just a couple more questions for you.
Okay.
What were you unable to do before undergoing the program that you are able to do now?
Initially when I had the tear, I couldn't even put any weight on it. And that was probably for 2 to 3 months. Then slowly I was able to, but I was limping. I did find a cane and I used that.
Sure.
Since surgery, I am fully mobile and hasn't prevented me from doing anything, all my ADLs, etc.
Great, awesome. Now you did mention tear. I'm sure there was some degenerative meniscus tearing, but one of the biggest things, as you know, that we addressed, or that Dr. Petropoli addressed in the knee repair, not knee replacement program, was filling in the bone here with some calcium phosphate bone substitute implant. And then, of course, in addition to that, you underwent the bone marrow and the PRP injections, which only helped that. Not only the bony structures, but of course, the soft tissue, the degenerative meniscus tearing and things like that within the knee. So that is great. One last question for you. If somebody were on the fence considering doing a knee repair, not knee replacement program, what would your advice be to them?
I would say go for it. I am way better off than I was a year ago, and I'm pleased with everything. Therapy and everything, it went well. And it really wasn't that bad pain-wise.
Awesome.
Only initially, just the day after the surgery, but otherwise, I'm very pleased.
Awesome. We'll keep up the great work. We'll see you in a year. We'll get repeat X-rays, and we'll just assess, to see how things are looking next step forward.
Okay.
Thank you. Great job.
Thank you.